We'll just give it a couple of minutes, maybe, or just about a minute at least more. We can start.
Good to go live now, Karthik.
Yeah, great. We'll just maybe wait for, I think we're a minute in anyway, so we should start. Good evening, good afternoon to everyone who's joined us, this rather nice spring afternoon here in Delhi. As I was just telling our panelists as in the preparatory room that we chose a time of year when things are relatively looking up to have this discussion so that we remind ourselves of what we are faced with for the rest of the year. At least in the air pollution groups, this is definitely a known mantra that that we need to talk about it year round. But and I think the presentation that we have for you today and the discussion really also speaks to more recent developments, which I think shed some new light on I guess what has happened in India over the last 2 decades. And it's important for us to understand also that what's happened in those in that sweep of time, so that we then prepare ourselves to sort of address those sources. As you know, the GBD MAPS group did a global study. I think the data for which came out, I think in mid 2021, and I think there was a follow-up paper, and the data sets came out in late 2021. Sharath, who will be presenting to you shortly, has done a great job of cutting out the India portions, right, snipping it for the benefit of the India stakeholders and creating various visual products. I think the link to that will probably be put up on the chat window sometime soon. Please do take a look once you've sort of gone through Sharath's presentation. And really the idea is for us to, I guess, take stock of, is there any new evidence that's come up, or is it the same old, as we sort of start yet another year of looking at speaking to air pollution stakeholders, right, whether it's pollution control boards or MOEFCC. That's we're in the 3rd year of the NCAP, and I think there is also, we're looking at how the funding allocation is going to be. So all of these could potentially be influenced by any information and evidence that comes up. And when I look up for what's the evidence at the national level in terms of source apportionment, all of it, I find that there are very few studies. So obviously we are looking at some of these international studies that are consistent in the way their methodology is across countries, to then try and understand how air quality is at the national level, because it isn't very easy to sort of talk about source apportionment at the national level, but these studies do help us do that, so that at the national level we can prioritize, right, whether it's, for instance, power plants, right, how much, and we've been dragging our feet on that. So without further ado, really, I'm going to jump to Sharath. We'll introduce our panelists once Sharath is done with his presentation. Sharath, over to you for the next 10 to 12 minutes to give us a sense of what you've gleaned from the GBD MAPS global study, specifically the India portions, and then we can get on to our discussion. Thank you, Sharath. Yeah. You're on mute, Sharath. Yeah.
I'm going to turn my camera off since I'm sharing the screen, just so that I don't get bumped off again.
Sharath, are you saying something? You can't hear you now. Did we lose Sharath?
Yes, Karthik.
Oops. Okay. We'll just wait for him to come back. That's very unfortunate. Sorry about this delay. but it is important that he comes back because we're going to start with the presentation of what the GBD Maps reveals. Yeah, he's back, I think. Sharad, can you hear us?
Yeah, I can hear you.
Okay.
I will. So because for some reason my comp has been doing this. So there is a contingency. There's a full video already at Tanushrie's desk.
Sure. In the event it happens, we'll try and intervene. Yeah, absolutely. Yeah. Okay. Over to you, Sharad. Yeah.
Hi. Thank you, Karthik. And thank you for giving this opportunity to present and be part of the panel. I will look at one of the publicly available databases to drive this discussion today. So our general practice is to rely on monitoring data, which is basically snippets of information, both spatially and temporally. We don't have enough number of monitoring stations in most of the cities. I think only Delhi and its neighboring places have a good amount of stations to drive some of this story just from the monitoring side. Now, using CPCB's own thumb rules, we estimated about 4,000 stations required in all of India. And as of last month, we operate only 310 continuous monitoring stations, which is definitely not enough. Even on the surveys and test side, we conduct to understand emissions, for example, spread across temporally. We don't do them on a regular basis. For example, again, a pool of emission factor tests for vehicles was conducted as part of CPCB's 6-city study in 2010. And there was again another round of state tests a couple of years ago. So it doesn't really help us in temporarily understanding how the emission factors are evolving in the country. So at the end of the day, basically snippets of information is what is available to us. On the other side, we have the modeling world, combining a large pool of data from multiple resources. This is helping us in building patterns in emissions, pollution, activity data, and all in the hope of basically plugging the gaps in the monitoring side. So when I say activity data, it ranges in many ways, as simple as vehicle speeds on the roads across the city, which you can pull from, say, Google Maps. You have lights, night lights data that's coming from multiple satellites. It can help us in understanding the population density or demand in electricity, especially the nighttime demands. So these kind of things are really helping us in building patterns. But this is not an easy step. In fact, both sides of the story are not easy at all. Here we illustrated major components of modeling exercise. All of them are data intensive. All of them are computationally challenging and require substantial amount of personal training to move forward. Emissions modeling, both aggregate emissions and spatial and temporal allocations, both of them need a lot of data and a lot of understanding and a lot of ground truthing. The next step is meteorological modeling, easier than the others, but computationally intensive. We can use some feeds directly available from the Indian Meteorological Department. But if we want to do more urban-centric work, let's say at 1 kilometer resolution for a particular city, then we have to do the modeling like WRF model all by ourselves. So that part won't be supported by the Indian Meteorological Department. Chemical transport modeling, it entirely depends on the requirements. If you are focusing on source apportionment, then you need a certain kind of chemical transport model. If you're focusing on photochemistry and ozone evolution, there's a different type. So like this, depending on your end requirement, there are a lot of models available, and the intensity of these models also varies significantly. And finally, you have the two major steps: validation, which is again dependent on the monitoring data. Then the dissemination for public awareness and policy dialogue, which requires a completely different set of teams to take the message forward. I mean, you have the scientists like us providing the information, but then we need another team that can take the message forward to both public and the public bodies to push the envelope. So while we are building our own made in India systems for understanding air quality, there are a lot of global systems in place already, combining emissions, meteorology, physics, chemistry, any monitoring data available, and the satellite retrievals to build a story on how the pollution has evolved over the past 20 years. On the screen, you have some examples here. So UCAR and MERA2, these are based in the US. ECMWS is based in EU. The SAS program is a reanalysis database built on NASA's MODIS satellite database by Dr. Sagnik Dey at IIT Delhi. And the fifth one is from Washington University, St. Louis. This is Randall Martin's team. So I'll focus on the last fifth one. This team has worked with Dr. Chandra Venkataraman, who is also on this panel, about 5 years ago as part of the GBD Maps India program, which was all the analysis at that point was done for the India domain. This new iteration is an update on that and presenting also source apportionment results for the whole globe. And they've also updated with new algorithms for a longer period from 1998 to 2020. So all these databases are available directly on their own website. Only the challenge is that everything is huge, basically. Just need some computational space and time to go through all these things. But it's a good exercise that we can definitely use to understand some of these trends. So I'll go over some of the insights from data extracted for India. All the data extracted and summarized for state and district level, they are also available on our Urban Emissions website. So please do take a look and download and see how it looks for you. So between 1998 and 2020, on average, pollution levels have doubled in India. This is also reflected in the calculated health impacts, which combines your population size change and your health metrics. Even taking that into consideration, the biggest driver has been change in the pollution levels. On average, landlocked Indo-Gangetic plains moved from poor to very poor scales, which is on India's AQI scales. And central India moved from moderate to poor conditions. Again, this is completely driven from energy intensive sectors, residential cooking and heating industries, power plants. So all of them have really contributed in an increasing way over the last 20 years. We can clearly see that the air pollution problem is not limited to the cities anymore. Looking at the same information overlapped with population and area, we pretty much halved the total population exposed to pollution levels that comply with India's national ambient standard, which is 40 micrograms per meter cube. So all the green bars that you see are basically under 40 micrograms per meter cube, and dramatically increase the population exposed to poor and severe levels of PM2.5, which is 90 plus. That's the red and maroon color bars on the graph. Looking at the same percent population exposed, the biggest drop came on the lower concentration side, which is 5 to 20 micrograms per meter cube. And these are the concentrations used to be our background concentrations across the country. So what this means is that we have very small percentage of population exposed to pollution levels complying with the new WHO guideline, which is 5 micrograms per meter cube. On the high side, we have more population exposed to concentrations more than 100 micrograms per meter cube. This has really changed between 1998 and 2020. So these highs are traditionally used to be in the cities, but as the cities are expanding, these numbers are also growing in area. And now we are seeing the same trends in the rural areas as well, especially in the Indo-Gangetic plain. Geographically, on average, we have 42% drop in the number of districts and 27% drop in the number of states complying with the India's national standard, which is not a good sign. So we really need to find a way to reverse this trend. Now, looking at what is contributing to the growing problem. So this is basically coming down to source apportionment. The pie is all India average population weighted. So 81% of the pollution is sourced to fuels we burn in all the known sectors. That's residential cooking and heating, industrial manufacturing, electricity generation, transportation, plus your dust from construction and road resuspension. The message is very simple here. So if we want to control pollution, we must find a way to reduce burning of fuels, or if we want to continue burning fuels, then we have to do it efficiently and with controls. So on average, across India, residential cooking and heating is the largest contributor. That's about 30%, followed by industries and power plants. So again, looking at some of the snippets from the data at the state level, power generation dominates in the central and the western states. This is, again, a big lobby. A lot of groups have been working on the power plant emissions. And we have a lot of coal mines which are directly closer to the power plants. And the delay in implementing the standards is obviously evident in those areas. Dust dominates in Gujarat and Rajasthan, which is expected. It's basically a dry and arid region. While waste burning is a constant presence in all the urban and rural centers, pretty much across the country, the share is highest in the northeastern states. It tells us, gives us an idea of what's the role of the urban management is in those parts, or lack of rather. The most talked about source, open biomass burning, on average annually, it's 2%. During the main burning season, in the October, November, in the areas of Punjab, Haryana, and Delhi, of course, the numbers are higher. Some days it reached as much as 50%. But looking from an annual perspective, it's about 2%. At the state level, transport shares don't do justice to what we understand as the share, its transport share in cities, air pollution, like source apportionment studies. So when we're looking at the state level transport shares, we should take that with a pinch of salt. So I think this is where the question of the need for high resolution analysis at the city scale becomes a lot more evident. So we understand that the models come with a lot of assumptions. While these insights are very useful, we must keep all these limitations in mind. So for example, global models run at a core spatial resolution. The example that I'm sharing today, it's the whole system runs at a 0.5 degree resolution, which is about 50 kilometers, which really cannot capture the core urban activities when we are looking at let's say a particular city. The satellite retrievals also, which are used for nudging some of these reanalysis work, they are basically just passes a snapshot over India, because these are not geostationary to India. They're mostly geostationary to US and EU. So if we want more longer timestamps information, then we really need to focus on trying to integrate some of the India geostationary databases into this analysis. We do not have a wide network of monitoring stations to feed these models enough. At the end of the day, these models do need some ground truthing, which will help us in calibrating and validating what's coming from the models. Despite these limitations, these models are helpful, should be used as a guidance for the time being. There is no second guessing that we must expand the monitoring network, not only in the cities, but also in the rural areas where similar growth trends are now vividly visible. We really don't have a good understanding of the trends in the rural areas. Whatever understanding we have is from these reanalysis databases only. We need more local level efforts to strengthen our understanding. This includes both having better bottom-up emissions inventories and top-down source apportionment studies. Now, especially the later one, we have to find a way to do them in the rural areas as well. If you take the current NCAP program, like all the source apportionment studies planned are only for the cities, and pretty much in the city's administrative boundaries. They're not even going outside those city administrative boundaries. So we really need to find a way to expand that gambit as well. So I want to stop here with these open questions for the panel, and looking forward to the discussion. Karthik.
Great. Thank you so much, Sharath, for taking us quickly through a whirlwind of what pollutes India and possibly even the different states. But obviously, this doesn't really speak about the cities themselves. As you rightly said, the resolution is not quite there. Before we jump into our panel discussion, I guess we must at least formally introduce our panelists to everyone here. None of them really need any introduction if you've been following the air pollution space, but just to ensure that everybody knows who's here. We have with us Professor Chandra Venkatraman, who is a professor in the Department of Chemical Engineering at IIT Bombay, and and she's basically involved in multiple efforts. In fact, as Sharath mentioned, the inventory that her group compiled, which is smog, has been used in the previous iteration of the GBD maps, and in fact, possibly even in this specific components were. and she's running she's part of also a new effort to update some of that work under the National Carbonaceous Aerosol Program. Chandra, thank you so much for making time. We also have with us Professor Mukesh Sharma from IIT Kanpur. He's known to, of course, all Delhiites because everything that Delhi knows about what pollutes it for a good part of the last decade came from Professor Mukesh's group. He's done the most recent source apportionment study that was commissioned by the CPCB, and I think that came out in 2016. And he's been involved in many global efforts as well, and multiple sort of committees that Government of India sets up have benefited from his expertise. We also have with us Dr. Purnima Prabhakaran, who is the Deputy Director and Additional Professor of Public Health at the Public Health Foundation of India. She leads a team that works towards environmental health issues spanning air pollution, climate change, water, chemical and heavy metal exposures, and also children's environmental health. And she's involved again in a range of multiple international efforts with the UNEP, UN, UNDP, UNICEF, among others. Thank you, Purnima, for making your time. And finally, of course, we have Sharath, who made the presentation. He's associated with Urban Emissions, of which he's the founder and director. And this has been happening for close to 15 years now that he's been running it. And he has affiliations also at the Desert Research Institute with OpenAQ, the platform that collates data on monitoring stations across the world, and has, I think, appointments at IIT Bombay and Delhi at various points in time. Sharath's also a global TED Fellow. So with that, we'll jump straight in. And as I was telling the panelists, Sharath has talked about air quality and what the numbers are across the country, right? Whether we are poor, what percentage of the population is exposed. But ultimately, all of that, must then translate to our understanding of how has that impacted, human health, right? We hear about so many deaths, so many instances of, morbidity, whether it's, COPD or ischemic heart disease, right? All of these that happen. Now, how does that come about, right? How do we translate the air quality that we see, right, to the actual health endpoints? That's something that Sharath is not delved into, and that's not, not his forte in any case. But we have an expert here among us, Dr. Purnima Prabhakaran, who I'd just like to call upon to, tell us very briefly, how does it then work from here, right? So we've got this reanalysis model that tells us this is the concentration across the globe at this resolution, right? How do we then translate this to, this is the amount of, impact that it has on health? I'm asking this question because we have a lot of deniers in this country, right? Pretty much every policymaker out there says that, nobody's death is certified as having come from poor air quality. So when you as a scientist go out there and put your name to one of these efforts saying so many people did die, right? What is the confidence that you have, and what is the process that you adopt to give us this information, Purnima?
Yeah, thank you, Karthik. Good afternoon, everyone. Thank you for the opportunity to be here, CEW. You're right, Karthik. I think the naysayers are only multiplying. And as recently as the recent parliament session, I think there was a question raised on what's the evidence from India on the health impacts of air pollution. Is there any evidence at all? And I think the response given to them was no. Sadly so, because I think particularly in the last 5 years, I think the evidence base has only increased in leaps and bounds. And so far, the refrain was by the powers that be that we are leveraging evidence that's coming from the Western world, from the developing countries. For example, even the global burden of disease estimates, they've said, oh, that's coming from countries in the developed world, the developed nations, and their pollution levels definitely don't apply to what we face here in India. That being said, I think increasingly we have opportunities, and we have seen research coming out of India, which has applied all these, what we call the exposure data sets. Now, Sharath presented this GBD maps data, reanalysis data. There's also multiple sources of exposure that we are leveraging. The ground monitoring stations data, the fact that it's inequitably distributed is one thing, but you have satellite data, you have other kinds of models. So all of these can be leveraged to, related to a variety of health outcomes. You must have increasingly heard, intuitively in the past, people thought poor air quality means poor respiratory health. But increasingly, the evidence base has grown to show that the impacts are across the life course, meaning pregnant women exposed to poor air quality, there's adverse birth outcomes. children, adolescents, adults, elderly, everybody is affected by poor air quality. So what we can do with these kind of reanalysis data sets or any exposure data sets is start relating and showing the associations with a variety of health outcomes. And we've started to do that for India. The way we do it is adopting a number of different methods. There could be statistical approaches, there are modeling approaches. There are very many innovative ways of relating all these exposure data sets to health outcomes. What we need is the data. And I must say, and I will use this forum to say, it's hard to come by good data sets. There are pockets of data, health outcomes researchers have data sets which we can start using to make the associations. But there are lots of data sets which should ideally be in public domain.
Can you name some, for instance?
So mortality data sets, for example. So we ourselves are working on developing another kind of modeling approach to relate air pollution to health outcomes. And it's a very fine granular model. Sharath was talking about 50 kilometers. So our model it's called an ensemble approach because it integrates a number of different exposure data sets, which includes Professor Chandra Venkatraman's work, the emission inventories, source apportionment data, the ground monitoring data, satellite data, as well as chemical transport models, land use data. We are integrating all of that and building what is called an ensemble model. We've finished it for Delhi and Chennai, and we are now scaling it up to a national level. What we are looking for is national level data for health burden. And sometimes it's hard to come by that data with the GPS codes. What you need if you're working at that fine granularity is the GIS coordinates. And sad to say, I mean, sometimes it's hard to come by those data sets. They're not in public domain, or if they are, we are not able to get the geocodes. So we are facing an ongoing battle to get data sets to make the associations. So on the one side, you have people saying that, where is the evidence base for India? On the other side, when you have the resources to do it, you don't have the data forthcoming. So I can come back on this later.
Sure, absolutely.
Just to set the stage for the context, for your discussion.
Got it. Great. Thank you, Purnima, for that. Chandra, we'll start off with you, because, you've obviously been a contributor to the, to this global emissions inventory database. So what do we actually learn from, globally modeled output? I mean, as Sharath said, this is happening at a certain resolution, right? So what is the significance of some of these global modeling efforts, and how does it help us understand air pollution better in a way that just sort of looking at a microcosm of a city does not?
So thank you, Karthik, and thanks for the invitation to participate. I think that you, Sharath, and Purnima really set the stage to go forward with a meaningful discussion. So, I'll give a few sort of details about these global modeled reanalysis data in order for us to, say, why should we use them? So on the one hand, I think Sharath already mentioned, it provides a consistent framework to evaluate both the levels of PM2.5 and source contributions to PM2.5 by assessing all the sources in the same way. And what is this way? This way, of course, is taking emission inventories and then putting them into what are photochemical air quality models, and then coming out with fields. And why is this called reanalysis data? We then assimilate, while running the model, we assimilate meteorology, which is run with a lot of actual meteorological data input into it. And so then that is considered as equivalent to true or measured meteorology. So that's where this idea of reanalysis comes from, is that it resembles all the atmospheric processes, whatever we're talking about, the atmospheric motion and all of that. So these models are complex. They treat the movement of the atmosphere. They treat how pollutants are chemically formed, chemically removed, how they are removed physically by rain, by all of that. So, that's in a sense, the highest level of detail you can probably get. Right. Then they provide spatio-temporal continuous fields. As Sharath pointed out, monitoring cannot provide that. And from these, annual averages can be developed, which relate to our national ambient air quality standards and also can be used for health impact assessment. So they are ready data sets. They can be used to evaluate changes over time, regional differences, and source impacts. So that's definitely one thing I will say. And of course, there are uncertainties, but I don't know if we should talk about them now or maybe.
Sure. Yeah, absolutely. In fact, that's probably the next question that I'm going to pose to you, right? So, given that it's a group that's, sitting in the US that's doing it, right? For instance, this particular one, right? Randall Martin's group. To what extent are they actually taking into account, information that's, India specific, right? To what extent do you feel that there are approximations? And I think, this stems from, a lot of good primary data not being available, as Purnima mentioned, right? In the case of the health effects side. Similarly, on activity side, right? India does not have, for instance, an energy balance that actually, that much of, for instance, the OECD has. So what do you think are some of the, are there limitations of these global assessments that, make them less useful? And, how do you sort of even estimate these uncertainties?
Okay, so let's just say there are several sources. Maybe let's try and, reduce it to 3 sources and say one, of course, is the emission inventory that's input. And I think that to the credit of the GBD Maps group, they have worked with the, regional, national inventory developers, with people in China, with us in India. Sarath was also involved in that. And then they took these emissions and integrated them into a global emissions database, which is called CEDS, which is the same emissions database that was used in the IPCC assessments. And so they scaled all their India emissions to essentially resemble what is it that we had as the best understanding of India emissions. So, that's about as good as you can get, maybe. But then, as Sarath said, there's 2 things. One is the underlying model. The underlying model, and it's GeoSChem in this case. And, you can use WRF-Chem, you can use WRF-CMAC, you can use WRF-CAMEX, whatever. But all of these have these secondary aerosol formation processes, and each one of them treats it in slightly different ways, etc., etc. And because of the resolution at which the model is run, 50 to 65 kilometer, right. Some of these sources that have very strong spatial gradients, your small fires, your vehicular emissions, etc., they get mixed into a larger grid box, and then you're kind of underestimating them because the model doesn't have the capability of estimating them at a finer resolution. And then, of course, this integration with satellite AOD. The satellite AOD is available at a high spatial resolution, but then you have this idea that, the model calculates what's called aerosol optical depth. It's a column product. And then you take a ratio of the PM2.5 at surface to that, and then scale it up in some way with the AOD from satellite. So then, there's some changes that would happen because of that. Nevertheless, if, for spatial and temporal consistency and continuity, these are definitely useful for evaluation. As Sarath pointed out, he's putting out data at district and state scales. And that's definitely a, spatial scale that you're likely to get, reasonably believable numbers. I wouldn't go to this, to maybe definitely not the grid scale in order to assess it. And as Sarath said, and as you said also, that we need other sources of data, perhaps that are collected more locally, in order to have better sort of understandings at those scales.
Got it. Great. That was, I think, very useful to know. And I think, people have hopefully, got a better sense of what reanalysis actually means and how we have to make do, right, with what is available to us to create these approximations in the absence of monitoring. Professor Mukesh, I'll just come to you on this. So, you've been involved in a range of city emissions inventories and source proportional exercises, right? Delhi, of course, you've done, more than one exercise. You're probably even going to do a third. And as we've established so far, the utility of some of these global scale models to talk about cities is probably a little less because, they don't capture the emissions within cityscape, as much. What do you think is these estimations typically miss out on when you look at city level emissions? And, is it possible to sort of really improve the way they look at cities? And how do you use, global emissions inventories and source apportionments to improve your assessment of what cities are experiencing?
Well, I think, very well put by the other speakers and panelists, and, very well articulated even the uncertainties that we have, global versus the local level kind of emission inventories. But you specifically asked me what are so different at the local level, given the global already, and what are so major differences, there are significant differences because some of the issues that we have, which are very India specific or, economically weaker section specific, the way they burn, the way they can, anything that they can recover by burning or, extruding something from there, they will do regardless. Of course, there are no regulations, or even if our regulations are there, the regulations, nobody will follow. And typical example I give is always, that, for example, every city would have some place which we have observed is a tire burning. So it's not, it's not the means to dispose of their used tires. They can extract the aromatic oil from there. So they would burn it. That particular source, for example, it looks so dirty and so blackish all around, but how would that be captured by anyone for that matter? I would wonder. I'm just getting to the specific questions you have. People have, people will somehow get the wires, with the plastic in there. They may be copper, they may be aluminum or something. They'll simply, very slowly they'll burn that plastic to extract out the metals from there, for example.
Mm-hmm, mm-hmm.
And, in certain areas, like especially in the mining area where the coal is somehow freely available,
Sure.
So that somehow we never captured that how much coal is coming in the city. They say, oh, there's no coal depots in the city, for example. But there would be certainly many people will be using the coal somewhere. So these are the very, at the local level, things are happening which are not captured. The other thing, which is right now, there is so much of massive construction in all of our cities, somehow the city is dug up. All, you come to state of Uttar Pradesh, most of the cities, some construction is going on. Our, medium cities or even the larger cities, there's a massive construction of metro, for example, for the last 3-4 years. So I don't know how these global emission inventories will account for the emissions, the massive construction that we have. I'll just do on the lighter side, and for example, in Kanpur, I'll just quote a small, thing of writing in Hindi in Kanpur. They say, Khuda Sheher, Khuda Sahare. So the whole city is dug up, and the Khuda hai, to Khuda ke sahare ho. So those kind of things are issues which how would the global emission inventories
Sure.
have that? So that is one part. And then of course, if you wish to come back to me, we can also talk about the issues uncertain in the model, how the model is performing.
Maybe one follow-up to you, given that, you also, of course, do both, receptor modeling as well as I'm guessing the bottom-up modeling for your source apportionment work. Do you rely on, for instance, such global data sets for establishing the boundary for all of your work at the city level? Because ultimately, as you rightly said, right, you have a view of what is happening within the city, which is much more accurate than what these models have. But are these the models, and is this the data that you go to establish what's coming from outside? Because ultimately, as we've been saying, right, we have to take this regional approach, right? And if everybody is focusing only on cities, who's going to tell us about what's happening outside of them? And that has to surely come from such exercises, right? So to that extent, are you comfortable using these to represent the regional boundaries at least?
See, that is what we do for the regional boundary, the larger regional scale models and say what might be just at the boundary of the city, that of course we use it. But you see, apart from that, for example, Delhi, for example, I mean, once this crop residue burning, especially in November, there are a lot of issues and all. So when we take the emission inventory globally available, and then apply the kind of models, WRF-Chem and, the secondary organic aerosols model, and then we find there's a lot of uncertainty in the model compared to what the air quality that we are getting. So these models also have to be sort of redone or revalidated. And I just wonder, for example, the way the biomass burning is happening, do the models can really account for that particular chemistry, especially for this particular thing? They apply some mechanism of, OH radical formation and all, especially MET sorghum that we applied for the WRF-Chem. That simply did not work at all.
Sorry, what is the specific? I didn't get it. What?
There's the WRF-Chem. There's a model called MET sorghum, MET-GM. So that accounts for the secondary aerosols.
Okay.
So and then it was accounting reasonably, but the moment we put this crop residue burning is there, then it simply failed. I mean, it was giving concentration extremely low. So then, of course, we could not change the model, this thing. So you go through your statistical means. Well, what would be the reasons, for this particular thing? So this model uncertainties are also very, very, very specific to Indian conditions, I wonder, actually. So the model validation, model sort of underlying mechanism, that also needs some revalidation, or the way we have done in some statistical sense to improve that particular the underlying mechanism. So that is also an issue.
Right.
So
I'll quickly, maybe just move to Sharath, Professor Sharma, since you've talked about the challenges of, making some of these work. So Sharath, I know we've been working with you, and of course you've been doing a lot of work on putting out forecasts for, the Delhi domain at least, and we've also tried to do it for other smaller cities in the Indo-Gangetic Plain. What is your view of, some of the challenges that Professor Sharma has put out here? I mean, I understand, of course, those are regular concerns that you will face in actually trying to put out forecasts. How do you handle some of these challenges that you see with, globally available inventories, and what have you done to overcome some of these challenges?
As I said in the presentation as well, the global models can give us some guidance. So that can start a conversation. But once we get into a particular city, we really have to customize for every sector. So this is where we really need some local surveys conducted, whether it can be digital mapping or even physical mapping. You do that to understand what are your major hotspots and what kind of emission strengths do these sectors have. And you can use that to do one scale of modeling. And what is the uncertainty in each of these sectors can only be established by going through a certain amount of chemical transport modeling exercise. Now, like Mukesh was saying, when you run the model, then you may see a lot of discrepancies in the secondary aerosols, or even just getting a sector profile, whether it's getting reflected in a particular area properly or not. So generally, we have an idea of, okay, in a city like Kanpur, you want to see 30-40% of pollution could be coming from transport sector, because that's what we have seen from the chemical analysis based source apportionment works. So if you're not able to replicate some of that in your chemical transport models, then you take a step back and say, okay, what am I missing in my emissions inventories? Is there a particular hotspot or a particular layer of activities that are completely missed? So that will really help us in understanding, in improving the inventories. So one of the ways this was done in our Apna second phase program is combining vehicle speeds information in the city at a grid level temporarily to some of the chemical profiles for emissions. So if you find that a particular grid at a particular hour was at under 10 kilometers an hour, then obviously your engines are not that efficient. So we can actually reduce some emissions, like your PM levels could be going down, but your incomplete combustion will lead to more CO and VOCs. So that will help in the photochemistry. So these kind of things will happen only if we do the chemical transport modeling at the level which is required to understand the chemistry and to drive the missing gaps in the emission inventories.
Right. I'm going to go back to Professor Chandra, now. Sharath talked about, trying to use locally available information on, for instance, the pre-existing studies that look at source apportionment, let's say in the city of Kanpur. But what we know is there isn't a source apportionment exercise for the bulk of the Indian landscape, right? And and I see that a lot of studies apportion the air pollution burden to biomass use, Chandra, right? Now, while it's undeniable, because we know that is definitely a big source, the source of information for that is kind of dated, right? And I'm not sure to what extent in your studies right now, at a national level, you've managed to get more updated information, for instance, on the prevalence of biomass use. We've had multiple programs that have tried to incentivize the use of LPG and all, but without the conduct of a source apportionment exercise in the rural areas, right, to actually see what is the background concentration associated with biomass burning, by attributing it to the source. How do we lend credence to these global efforts, right? And to that extent, what is the domestic community doing, right, to either reinforce that message or to fix that message that biomass is the problem?
Yeah. Okay. So, I was really happy to see the comments of Mr. Sharma and by Sarah. So, there's two issues over here. One is, yes, there are chemical mechanisms, but there are multiple ones available. I agree with Mr. Sharma that radon-2 sorghum with made as the aerosol microphysics doesn't produce secondary organic aerosol, but that's because it doesn't have biogenic chemistry in it. So it doesn't, do the photochemistry of isoprene, limonene, alpha-pinene, etc. We have found, for example, that a different chemistry, Rackham, VBS, or what's called Mozart, Mosaic, work a lot better on secondary organics. So, it becomes the job of our community to sort of run these models with multiple different configurations and, as Sarat said, make them work, at whatever scale we want to. And yes, a model is only as good as it can represent reality. So that's sort of what we have to also do. Then the other sort of thing, is what is the correct temporal and spatial scale in which measurements to models? Okay, if we are going to look at hourly, if we are going to go and say, oh, it's capturing the diurnal profile at this station where I'm measuring it, it's not, and so on and so on. That's not the skills. And in fact, there are some wonderful papers that have come out of something called the AQMEI, AQMEII study, which is, out of both communities, which literally tell you what kind of spatial and temporal scales and how to statistically compare models and measurements in a defensible way. Right. So we're not kind of comparing apples to oranges. And literally one of those papers is named Comparing Apples and Oranges. So, these are all things which are hard to do. They're really hard to do. Then the other thing which Sarat said and which, Mr. Sharma also said, which is that, we really have to have sort of these multiple threads of evidence. We need to kind of have evidence coming from these different weight of evidence methods. That yes, we do have measurements, we have whatever source apportionment that comes from measurements that's available to us. We may have something for 2 different timestamps for a location. How is that changed? Did it change? So, these are the kinds of a lot of analysis, in fact, more analysis than measurement. So if I were asked to make a recommendation for our NCAP, I would say, let's do analysis before we go in and do more measurements. And then to answer what, you asked, saying, are we updating biomass burning? Yes, we are. And yes, this is coming from over 20,000 odd national surveys. So we have these 15 institutions all the way from University of Kashmir to Mysuru, Bikaner to Jorhat, participating in these surveys. And so we have some, and there is a shift. There's clearly a shift. But whether that shift is only in terms of connections, whether it's, LPG refills are affordable. Now, these are all the kinds of things Prayas is, looking at and so on. And so a lot of it has to do with affordability. A lot of it has to do with supply and so on. So I think just to kind of quickly say 2 things. One, of course, is that our communities making data public, and making data public needs the okay from the government funding agency. So this becomes a crucial thing somehow, together with citizens groups, with think tanks, with everybody. We have to prevail on funding agencies to permit us to make data public, and then have some kind of consolidated integrated portals, and then have weight of evidence. What is the measurement data telling us? What are other emissions data? And I will just put in the chat the details we've now made the Smog India emission inventory public, and you can, send an email and, request data sets. We have historical data from 1985 to 2015 available, and then we're looking at future, which comes out of V2. So yeah, all of this definitely needs to be done.
Right, absolutely. Thank you. Now shifting gears back to the health side, Purnima, I want to bring you in here. So you've obviously worked on the state level disease burden initiative. Subsequent to the release of the last India specific study, I know you went ahead and did a state specific one. How successful have you been with communicating at the state level, right? Not just communicating, I would say, even establishing that that these are the impacts, and that to disaggregate that at the state level and come up with reasonably robust estimates. How you managed to do that in the Indian context, and if you can give us a sense of that, that'll also help us establish, okay, what do we need to do as a community going forward to take these national level numbers to states, so that they can then be convinced to act on their specific sources.
Yeah, thank you, Karthik. Specifically on the state burden of disease initiative that was done by, in collaboration with ICMR, PHFI, a number of different collaborators in India. So I think that information is out there. It has been disseminated widely to all the states. I think at the end of the day, it's to sound cliched, it's the gap that remains, between policies and programs and ultimately how it's implemented. So the same goes with, I think, research. There is the evidence, but the evidence to action through policies and programs, I think it's at the end of the day, it's for the states to kind of take it up. And I'm sure health is a state subject. We know that. And, it's for the states to kind of take up the evidence that has been put across to them and devise their own programs and policies. State action plans. We have state action plans for climate change and health. We are having city action plans for air pollution. So I think at the end of the day, it's the implementation that has become the challenge. And we all know now, air quality, air pollution, it's not one sector. It's a multi-sectoral kind of action plan that needs to play over here. So the health data is out there, and I don't think we need more evidence. I mean, that can continue growing the evidence-based health impacts of poor air quality, on morbidity, on mortality. That can continue growing, but I think it's time for action. And I think whether it's unlocking finance to do it or whatever, I think it's the implementation that has continued to be the challenge. And
so talking of implementation and making it more suitable, right? The question really that I had was, you've obviously apportioned deaths and morbidity to different pollution sources in different states, possibly even at finer resolutions through your work, for instance, in Chennai. And have you managed to sort of show how the priority of action should be, so that linking it to outcomes? For instance, right, one of the big things is exposure and ambient concentration are two different things technically, right? So how you manage to integrate this exposure, right, to then showcase to states that acting on these sources will actually help you achieve better outcomes in terms of health. So is that something that has happened, and do we need more data for that, so that given the paucity of funding, if you have to prioritize sources, right, and go after ones where the exposure is high, we can do that effectively? Is that something that you've managed to do as a group?
See, I think in terms of, the data is there showing the evidence at state level, right, on the disease burden, on the mortality. In terms of addressing the sources, I think, again, that is something which the state action plan needs to address. It's a very decentralized kind of action that is required. The emission sources are different in different geographies, right? So I think it's eventually something that has to be customized for the state. In Delhi, it may be transport, it may be industry. Somewhere else, it may be something else. So I think that contextualized action has to occur, irrespective of the disease outcome. I think the health effects are across the board. All vulnerable populations are vulnerable to a range of health outcomes. I think the action to address the sources has to come from other sectors, being propelled by the health sector, of course, because the evidence is now stark. It's there, it's real. And I think in terms of the messaging, I think there is some scope for action. For example, I'll give you, so one of the first papers that we put out after we developed our ensemble model is to relate it to hypertension, for example. So, hypertension is an intermediate risk factor for cardiovascular disease, heart attacks, ischemic heart disease. So our work in Delhi, what the association that we showed was, for every 25 micrograms of increase in PM 2.5 level, the systolic blood pressure increases anywhere from 3 to 5 millimeters of mercury. See, at an individual level, it might seem if my systolic blood pressure is 120 or 125, shouldn't make too much of a difference. But if you translate that to a population level, how many more people are going to be suffering from high blood pressure? And how many more people are going to need healthcare access? I think that's the kind of messaging that sometimes needs to go to the states. Maybe you already have your health infrastructure. We've just come out with the COVID pandemic and we know how well we did, right? So a health infrastructure that is already, struggling, you just push more people into the health system because you have not addressed your upstream determinants. Address your air quality. You're going to probably prevent a whole lot of people getting into that health system for getting treated for hypertension, is what we've shown already, but also for glucose, blood, so diabetes and things. So I think that messaging also has to change. We have started doing it. We are trying to tell the policymakers, so these are the impacts that you're going to see in terms of the burden on your health infrastructure if you don't address your air quality. So I think a little bit of that kind of messaging in terms of the costs to the government in terms of treating the disease burden that's going to come with poor air quality. And of course, economics. I think showing them the cost of inaction in terms of the health impacts, the economic impacts, I think sometimes the numbers work. So if you show them that this is the economic cost to not addressing air pollution, I think that kind of unlocks some action.
Right.
And those kind of messaging as well. I think we've started to talk in a different way.
Okay, interesting. I mean, but again, in all of these, are you facing pushback? Because so to what extent have you had to actually sort of, adapt these globally available data sets? Because at the end of the day, right, we only have, city-specific assessments for maybe, a handful, maybe, 10, 15 cities, right? For the rest of the country is not there. So to what extent have you had to adapt this global assessment to make your case for the local? And what kind of effort does that involve? Because, this goes back to the question that I'm going to pose to the others as well, right? How do we build this capacity to be there in many more institutions to be able to do it, right? So whether it's PHFI, whether it's IIT Bombay, whether it's IIT Kanpur, right, located in, in these cities, and you've got so many more areas where we need to talk about it. So how do we translate some of the work that you're doing, right, to adapt global models to maybe, as I said, with an ensemble view? And what kind of capacity have you do you envision being needed to do this in a more rigorous manner across the country?
So I think there's two parts to your question. I think in terms of adapting the global models, I think the state burden of disease kind of adapted the GBD work and did that at state level for India. So that's one piece of work. And that takes a certain approach. You develop the exposure response curves, and then you look at the attributable risk factor, what disease burden or what mortality is attributable to air pollution. So that's one approach that we use. But as a next step, as it was more a parallel step that we started was with this model that we are doing, because this is completely India work. This is just leveraging data in India. Data from ground monitors, I said, from satellite data, from Dr. Chandra's emission inventories. We've put all of that into the model. So that's how it's different from other models that have been conducted so far in India. And so that model is now being used to actually associated to health outcomes data in India. It's not estimates, it is actual epidemiological data. So in terms of national data sets, we are facing some issues in granularity of data that we want, but we have reached out to a number of health researchers across the country who have different data sets, whether it's birth outcomes data or adult respiratory data or cardiovascular data, and we are starting to make those associations. So I think we are not adapting the global maps work here. This is something that is homegrown. we are doing a different kind of modeling over here. And but in the absence of anything else, adapting the global data sets is useful because it shows that there is out there which can be applied to India and contextualized to India. So policy shouldn't wait. I think we
sure. When is this work likely to be published, Purnima? I mean, the Chennai and the Delhi one, is it anytime soon?
I already put it there. Somebody asked about the methodology paper is already out, and
fantastic.
Post the links to the hypertension.
Great. I think you may have posted it to hosts and panelists sometimes. So just take a look, or you've answered the
Q&A. Okay. I think in the Q&A somebody asked.
Perfect. That is fantastic. That is fantastic. In which case, let me move that question to Chandra and Professor Mukesh, right? I mean, the question is, I'd mentioned this, even another group, for everything we run to, professors at IIT, to help us resolve our issues, whether it's, emissions inventories or whether it is, building capacity. But at the end of the day, there have been a whole bunch of, I think, institutes of repute, for instance, that have been identified across the country. Chandra, you mentioned, institutions from Kanyakumari to, south and, in east and west. To what extent is the capacity to maybe, do some of these assessments actually being created in these different pockets, right? I mean, I understand they are networks that are supplying you with data and inputs, but to what extent are they able to sort of more materially contribute to these assessments and, whether it is, do locally relevant analysis, right? Or whatever else that might be. Do you think that's happening at the pace that's required? And Professor Mukesh, I'm going to sort of really ask you to reflect on the same. So maybe you can think about it as Chandra is answering her question. Yes.
Okay, thank you, Karthik. So, we're doing it within the Coalesce network. And so we have some 22 institutions and they are not just feeding us data. And so they are learning, how to do trajectory modeling. They're learning how to do PMF modeling. The core institutions are generating the really fine chemical data, but that's going right back to the institutes that made the measurements. And we've had a very large number of workshops. And so perhaps trained of the order of 80 plus masters and PhD students in this phase. Right. Now, what is required seems to be at a couple of levels, right? These are all complex. I think the NCAP, NKN Institute network is a very good place to start, right? So it's a very good place to start, but I think we need things happening at two levels. On the one hand, I think we need to have capacity building in this wider network of institutes to do this, where the analysis part should be something that everybody does. But where are the data? The data have to be in some centralized portal in a way in which they can be easily downloaded to do the analysis, right? Mm-hmm. Mm-hmm. And that is something that only funding agencies can permit us to do, can give us the resources to do, can, finally permit us to make it public and so on. So there's that outreach. But the other thing also is that I think given the fact that you're saying we go running to IIT professors, it's hard to run these models. And we have a huge, competition for the computational resources at IIT, and it's not possible to keep the national labs are where all the computational facilities are. Whether you go to IIT in Pune, you go to NARL, you go to whatever. That's where the resources are, and we don't have access to them. So I think that we need to find smart ways to go to what are called reduced form models. Find some way where we take these complex model output and like, Purnima said regarding ensemble approaches, some other approaches, put some reduced form models out there, which everybody can run on a single processor machine. I mean, that seems to be the way to go. I won't take up more time. I think Mukesh will have some ideas too, yeah.
Yeah, Professor Mukesh, I guess the question to you, and I remember, I saw some notification, for instance, from the UP Pollution Control Board, I think the member secretary that talked about you having developed a template, for instance, for, inventory gathering, right, at a city level, so that, it's like an SOP of sorts. How easy is it to operationalize that SOP, and train institutes so that, they can then go about doing it, without too much hand-holding or, just oversight from you?
Well, we have developed this software which we will hopefully launch very soon. And the idea is to put it in the public domain without any cost or something so that everyone can use it. And also there'll be a lot of examples done. There'll be a manual to sort of look into. And since it is a Windows-based, a lot of help menus and all. So if you really see, I mean, we have covered some like hundreds of sources, at least 20 types of aircraft, just to say that as aircraft can, different emissions and things like that. So that will require certain training, but the younger generation, I believe, I mean, once they have a little background of emission inventory, they will be able to just go through and do it themselves actually. Only issue comes sometimes they don't have the right feel of the numbers actually, frankly speaking. So the computational will give you some number and you're never able to figure it out. Well, is there something has gone wrong, or did I do some wrong entry, or that particular field, in my opinion, to run little sort of calculation is all right. But, that experience is a little bit more required. So they should have the opportunity to, for example, they compare the things to understand these numbers are not incorrect. So that part is there. So that we are coming up larger for the obviously for the advantage of our use of everyone for that matter. We have multiple sources built in there actually, and with a lot of flexibility, people can you give the activity data, you can even change the emission factors, for example, the way you want to say it. You can change the sulfur content or whatever. There are multiple things that have been given. So that part is definitely there. And I hope that people will use it. And that the fundamental thing, what I'm saying is, at least this will bring a precise way of inventorizing the things. Otherwise everyone is doing differently. Everyone is doing in their own way, own emission factor, own numbers, all kinds of things. And there's no comparison possible across. So I think that may not be hugely accurate, but would tend to be precise actually. So that's specific to your question actually.
Correct. Professor Chandra, you mentioned you've trained, I think the order of 80 or, hundreds of students and, PhD students and master students. What will be good is to understand, where these students today are. Seriously, I know we are on a panel, but we're also always looking for, capacity within the country. It would be good to actually create that database, of where these kids are, right? So that, we can actually put them in touch and ensure that there's a career opportunity, perhaps, right, in one of the institutions that is, either on this call, I see that there are funders, right? And I see there are perennial posts for, these jobs. So would be fantastic to know where these people are. Yeah.
Right. So we'll put out a database of the students in terms of, people who participated in inventory and who participated in other activities over here. That's a very good idea. And we should, find a way to disseminate it to the community.
Right.
Yes.
I mean, and you talked about, with permission, I mean, given that, you work with government resources, you require permission to put it out. I mean, and one of the challenges, of course, of, keeping some of these databases going is that there has to be frequent additions and changes that have to be made, right? Now, what we've been discussing with, with Sharath, is that, why not make this moderated and yet crowdsourced? Right, you can have a moderated sort of, like a database where, you control what goes in, but at the same time, you allow it to be crowdsourced, right? And, as long as, and I think the job then effectively becomes of verifying the kind of data that's going in, and that can be automated, right? Why aren't we considering something like that? Because otherwise, right, every time we're looking for a large grant to update the entire country, which is never going to happen, right? So, Purnima, if you're looking at, doing this for multiple different parts of the country, right? Would you not be open to looking at, putting these models out so that, models offer that matter, the underlying data? And
certainly, Karthik. I mean, we finished it for Delhi and Chennai, as I said, but we are working on scaling the model to national level model. Yeah. And that's where we've been facing the challenges for data sets. So, but our intention is definitely to put it in public domain. We're going to have a dashboard which is going to be accessed, in the public domain. So people use the model.
Right. I think, I'm being, but yeah, Chandra, maybe you want to respond to my question.
So, So, I mean, we want to take it step by step. And I think similar to what Mukesh said, what we'd like to do and what we are doing right now is really building what's called an emission inventory management system. And so we have developer interfaces and we have user interfaces. And so the developer interfaces then, would be a large number of but somewhat trained people who know really how to update activity data. And then of course the formats for everything is set and is downloadable. So you can upload data in the same format and so on. So that's something that we are trying to do, and hopefully it'll be done in the next year or so. But the question is, who is going to host it? And who is going to, curate it, host it, keep it going? We work with PhD students. They get really good and then they're gone. And, I have nobody, I have to start again with another PhD student and get them up to that level. And then, they're gone. So we really need some kind of partnership with think tanks, with others and so on, where some of these learnings can then be hosted and can be, kept alive and made usable and actually used. Right?
Right.
Yeah. Right. So that's one. I think it's a great idea to think about, crowdsourcing and so on, but it's so much chaos.
We should. This is definitely off. We should discuss this offline amongst perhaps interested parties. Professor Mukesh and Purnima and Sharath, we'll certainly rope you in. I'm just trying to understand whether there are any, questions. I think, thank you so much to the panelists for, patiently answering many of those questions. I think there's one from Manpreet Bhati, which I think, Chandra, you've indicated that you may want to answer, but I'm, maybe Sharath or anyone else can also take a crack at it, really. So
I'm sorry, I clicked on the wrong
that's
one.
Okay. That's fine. But, the question is very interesting. And I think it points to what I had asked earlier, but he basically says, is it possible that residential cooking and heating has huge contribution unorganized industries located in mixed areas, right? In the sense, they burn their fuel before 9 a.m., between 5:30 and 7 when it's clean, and then it says pollution control folks don't really even, tend to notice anything that happens before they start their work. Can satellites be used to really, monitor these kinds of fugitive emissions, right? Is that even possible? Sharath, I'll let you take a crack at it because, you've gone around looking at, these kind of sources and how you account for it. Your views?
One is, I think, satellite data can't be directly used, mainly because whatever information we have are not geostationary to us. Now, if we had geostationary feed, then we'll definitely be able to crack this.
Right.
But in the last 3-4 years, at least in case of Delhi, because of these real-time source apportionment systems that were put at IIT Delhi, so we were able to see this temporal evolution of the chemical nature of the particles. So that really helped us to see, if there is aged biomass are we capturing that, or is it a fresh biomass that we're capturing in the system, or is it more sulfate, more nitrate, more chlorine? So it really helped us in understanding the temporal profile of when certain fuels are being burnt.
Mm-hmm.
But again, this is a very expensive exercise, and one piece of equipment costs $1 million when we can't have this in 100 cities to understand this.
Sure.
So there is a way, of course, like satellites are also not cheap. So we can do an assessment like this, but it will take a lot of understanding the chemical nature of the pollution that's there temporally. But whatever information currently is available through some of these experiments, we are definitely able to use that and be able to track some of that in our analysis.
Fantastic. And we've got 2 minutes more. Maybe just do a quick round if anybody has actually closing comments. But Purnima, specifically for you, I just want you to maybe reiterate, right? One thing you did say it already. You alluded to the comm side of it, but maybe reiterate the point again. So, what do you think is the way we take, there's messaging obviously that's available already, right? That says, so many deaths happening on a yearly basis, on account of PM2.5. We have a reasonable resolution on that. So what do you think has worked in places where you think it has worked, where you've tried to sort of relate, air pollution with, whether it's, what is it? Not just all-cause mortality, but as you specifically seem to focus on hypertension and all of that, and that seems to have gotten some traction. So for anybody else out there who's trying to make this point with city authorities and trying to get them to act, what would be your advice on making more effective communication and health impacts?
I think in terms of communication, I think the health sector definitely has a big role to play. Like, doctors can themselves kind of put out the messages, and we are trying to do that as well, because oftentimes this has not been in medical curriculum earlier, right? We have learned about tobacco as a cause of lung cancer, but air pollution was never there in the medical curriculum. So we are starting with the doctors, sensitizing them, increasing their awareness. When you're seeing your patients, think about air pollution as a cause. Talk to them about it, talk to them about prevention, what are the measures that they can take. So one is, the messaging that health professionals themselves can do. But we're also leveraging our own, network of hospitals. We have a group and a member network of hospitals, and we're using that, location to kind of be the fulcrum of sensitization and creating that groundswell of awareness on health effects of air pollution for the communities. So given that, you don't have a good distribution of air quality monitors, we've started an exercise where we are putting up air quality monitors or having a TV display in the hospital waiting room where we are showing them, we are pulling data and showing them the air quality of that region. And we are focusing on tier 2, tier 3 cities and superimposing that air quality information with the health effects in the regional languages. So population, the communities, the local communities are becoming aware of the health effects of air pollution. So I think it takes, bottom-up approach as well to make people aware. But in terms of talking to the people at the top, I think the messaging, like I said before, has to be not just on the costs of inaction, of addressing, the air quality can be on your health infrastructure, on the health systems at large. So I think it takes multiple approaches, and those are some of the ones that we started to adopt and use.
Great. We're 1 minute past. Really, if anybody had any burning comments to make, please go ahead and do make it. Chandra, you have your hand quickly.
Just one very quick thing. This communication also has to be two-way, and right now we don't seem to have any idea of a implementation tracker. We say this has to be implemented. Who is implementing it? What is an indicator showing that it is being implemented? Where is this being recorded? And are we being shown today that, these many, whether it's construction sites, these many, highly polluting vehicles, these many have been removed from the roads. So we really need to have regulatory agencies somehow brought into the gambit and made responsible for feeding data into whatever implementation tracker that we, because without that, we're just talking. We think we know the problem, but what exactly is being done on the ground is, something that we need to also make people responsible for.
I think it's accountability at every level, whether authorities or the think tanks, the policymakers, or, other communities, I think. Accountability is very important.
I have a related question, Professor Mukesh, before you answer. So since Chandra brought up this point, right, and since you're so closely involved with Delhi, maybe this is a question for you to sort of look at, as you even do the next round of source apportionment exercises for Delhi, right? Which is, we've seen some claims that between 2014 and 2018, or possibly after, there has been a certain reducing trend in the pollution in Delhi, right? Now, if somebody were to ask, right, they would say, oh, we've built, this peripheral road in Delhi, right? We've done, whatever, dust sweepers and all of it. Now, one, of course, is whether the reduction actually has happened, whether the methodology is concerned, but let's assume that it has happened. What would you attribute, right, as action having happened that has actually caused this decrease, right? And that goes back to the point that Chandra was making. So do you think a system is in place today to actually attribute certain actions to, finally the impact on air pollution?
See, I think it's a politically sensitive question also at the same time, what you're asking, because there are many claims of, many things have been done by many people. And to say that this particular thing has resulted in this, improvement or something is difficult to say right now. But there are a host of things that have been done. But I think one major reason is the LPG uses. That probably, from the pollution that is coming from the far distances into Delhi, that is one thing which, at least during this period looks significant. And apart from that, many actions that have been taken, the trucks have been out. Otherwise, the trucks were the major contributor. So that the peripheral you're talking about. So there are many trucks are not entering in the Delhi. Otherwise, they would.
Then they're traveling, 10 kilometers or 15 kilometers more, right? It's not that far. No?
you know, the inverse of the distance square would always work.
Sure. I mean, as I said, we need to be able to quantify this. And I think that's the capacity we want to have within the country, right? To see whether that actually works.
That is there. But of course, there are many things have been done. There are many claims. But this is certainly a thing that there has been some improvement. Our data, our statistical analysis also show, not to the extent that we feel, you know, oh, well, that's something great. But
sure.
My last very, 30-second point is,
please, yeah.
Well, we are using certain models and all, you know, the pathology and diagnostics, even if it's inaccurate, even if it's incomplete, even if it's indicative, but what it is leading us to take the major actions. So we have to keep doing better pathology, better diagnostics, but it is also need to have treating physicians, treating surgeons. Ultimately, what we want is a better air quality. So I think that direction has to, at some point, also the entire focus has to go to that. That's my last point.
Great, thank you. Thank you, Sharath, for one, of course, putting this data together, and just getting us, to really talk about it. Let's just hope that, we establish some sort of collaboration to further the good work that, Professor Mukesh, Chandra, Purnima are all doing. Interesting to know that, some of these, possibly, more scalable approaches are also available within the country. Purnima, really looking forward to working with you on, on this ensemble model and trying to see, whether we can adopt it, right, in the regions where we're working. And Chandra, good luck to you as the latest round of emissions inventory sort of gets updated. We're looking forward to that as well. And Professor Mukesh, as I said, we hope you will solve Delhi's problems sooner than later. Yep. Thank you so much, everyone, for agreeing to be with us, and for everyone who stuck around till the very end, and for giving us your generous time. Thank you. I hope you found the deliberation useful. Thank you. Yeah.
Thank you.
Thank you very much.
Thank you. Bye.
Thank you. Bye-bye.
Bye.